A teenager should not need a hiding spot to take her medicine. But in healthcare, that is still normal. That is what made this story about inhaled insulin more than a diabetes update. It became a bigger question. If one small device can remove daily friction for a patient, why does so much of healthcare still feel unnecessarily complicated? A young athlete with type 1 diabetes recently switched from multiple daily injections to inhaled insulin. It was not just a clinical change. It was a lifestyle change. She stopped planning her day around privacy. She stopped stepping away from her life to manage her condition. She took her medication and moved on. Simple, quiet, fast, and something shifted. She felt less defined by her disease, less interrupted by it, more in control of it. That is the part of medicine we do not measure well. In clinics, we measure numbers. Patients live experiences, and they do not always match. Here is the uncomfortable truth most physicians already feel. Healthcare is not just complex. It is friction-heavy, not by design, but by accumulation. More documentation, more approvals, more steps, more systems, more rules. At some point, we stopped asking a simple question. Does this make care easier or harder for the patient? Because when it becomes harder, we feel it everywhere. In adherence, in outcomes, in burnout, in revenue, in workflow. Friction spreads. That is why this story is not just about insulin. It is about design, how care is structured, how experience is shaped, how medicine fits into real life. Because what the patient really gained was not just a drug. It was freedom. And in healthcare, freedom is rare. We talk about efficacy and guidelines. Patients ask something simpler. Can I actually live my life while doing this? If the answer is no, even the best therapy fails in practice. If the answer is yes, everything changes. Now here is where it gets uncomfortable for physicians and clinic owners. The same friction exists on our side. Patients carry treatment burden. We carry administrative burden. Different worlds. Same problem. Prior authorizations. Billing complexity. Documentation overload. Workflow friction. And over time, complexity becomes the default. But complexity is not neutral. It costs time, energy, clarity, and patience. So the real question is not whether inhaled insulin is better than injections. The real question is, what happens when we design healthcare to remove friction instead of add structure? Because structure without simplicity becomes weight, and weight slows everything down. There is a quiet shift happening in healthcare. We are moving from a system that only measures outcomes to one that increasingly depends on lived experience. Not just did it work, but could the patient sustain it? Not just did labs improve, but could life continue normally? That is a different definition of success, and it changes everything. Here is what physicians and clinic owners already know. If treatment is too complex, patients stop. If workflows are too complex, staff adapt around them. If billing is too complex, revenue leaks silently. Everything eventually bends toward usability or breaks under complexity. And that is the real lesson. Not about insulin, but about friction we have learned to tolerate. The systems we stop questioning. The steps we assume are just how it is, until someone removes them. And suddenly, we realize they were never necessary in the first place. Maybe the biggest problem in healthcare is not lack of innovation. Maybe it is tolerated complexity. Too many steps no one challenges. Too many processes running on autopilot. Patients want less disruption. Physicians want less administrative drag. Clinic owners want less chaos. But the system keeps adding layers. And simplicity becomes rare, yet powerful. Because simplicity is not less sophistication. It is the removal of what does not matter. So here is the question I will leave you with. Where is the unnecessary friction in your practice that everyone has accepted as normal? And what would change if you removed just one layer? Share your thoughts below. And if this resonates, share it with another physician or clinic owner who is living the same reality. Because healthcare does not improve by adding more. It improves when we finally remove what does not belong.